to What Does It Take to Be an Age-Friendly Community webinar. My name is Carol Ching, and I am a Senior Policy Analyst with Seniors in Housing, and I also lead the Government of Alberta's Age-Friendly Alberta Initiative. Next slide, please. Great. First, I just want to start with a few housekeeping items that we have. If at any time you're unable to view the video or the presentation slides, please just close your browser and reconnect. Time has been set aside afterwards, so we will have time for question and answer. You're free to ask questions at any time at all during the presentation. You just click on the little Q&A question mark on the top right of your screen and follow the prompts, and then click the Ask button. Our presenters will answer as many questions as they can within the time that is allowed, and our session will end promptly at noon. Today's presentation is being hosted by the Alberta Age-Friendly Community of Practice. The Age-Friendly Community of Practice was initiated in February of 2017 by Strathcona County, and to date we have 3 communities that are provincially recognized by the province, the City of Edmonton, the City of Calgary, and Strathcona County, along with representation from Seniors in Housing that is part of the Community of Practice. And we have been getting together to discuss how communities that are embarking on age-friendly can come together and share their experiences, best practices, and expertise. The Community of Practice has also been talking about how they're going to expand and how we can include other communities that are in the process of becoming age-friendly, or those that were just interested in embarking on this process. And we will provide more information from the Community of Practice in the future to you on that. Also, following the webinar, we will have a brief survey that will go out to all participants, and in that survey you'll have an opportunity to provide any other questions that you didn't get answered today. Any suggestions you have for future webinar topics we'll be looking for, and also if you're interested in connecting with the Community of Practice. Next slide, please. Our presenters today are Caroline G. and Raynell McDonough. Caroline joined the Edmonton Seniors Coordinating Council as the Age-Friendly Community Connector in April of this year, and she'll be providing support to Age-Friendly Edmonton's next phase of work. And previously, Caroline was with the Alberta Motor Association and worked in the area of seniors, driving, and mobility. So welcome, Caroline. We also have Raynell, and she is a strategist with the City of Calgary and is the lead for the Age-Friendly Calgary Initiative. We also have in the room with us today Donika Simmons with Strathcona County Family and Community Services, and Donika is going to be monitoring our questions for us today. So thank you, Donika. So during this inaugural webinar, Caroline will provide a brief introduction to age-friendly and what it takes a community to become age-friendly. And then Renee will be joining us by phone from Calgary and is going to share Calgary's experience, how they got started, who's involved, and some examples from their projects and some of the outcomes, as well as the impact of becoming an age-friendly community. So next slide, please. And I will turn things over to Caroline.
Great, thank you very much, Carol. I'm very happy to be here. As Carol said, I'm the Age-Friendly Community Connector for Age-Friendly Edmonton, and I'm with the Edmonton Seniors Coordinating Council. And one of the main reasons the Edmonton Seniors Coordinating Council was formed in 2005 was to lead the development of a broad strategic plan for senior services in our city. To do this, we adopted the World Health Organization's checklist for age-friendly cities as a framework. The World Health Organization has had a considerable amount of research and has amassed knowledge relating to aging and health, which serves as an excellent foundation for communities who are looking to be more inclusive to the needs of the aging population. The proportion of the population that seniors make up is increasing all over the world. By 2050, 1 in 5 people will be 60 years of age or older. While Alberta may have a younger population compared to some other provinces or countries, we will have 1 million people aged 65 plus living in Alberta by 2035. This means 1 in 5 Albertans will be a senior less than 20 years from now. Encouraging communities to become more age-friendly is being proactive and helps communities to embrace the gifts that our elders bring. Every place is different, and of course, every older person is different, and their needs and their issues vary depending on an individual's life course. Next slide. A universal truth is that health is crucial to how we experience older age, but we don't often think about all the things that influence health in older age. On an individual level, our genetics, our behaviors, age-related body changes, and disease affect our overall health. But environments we live in also have a big influence on our health. Where we live, what social facilities we can access, how we are able to get to places we want or need to get to, and also assistive technologies available to us also influence our health. Healthy aging is being able to do the things we value for as long as possible. So what's needed for healthy aging? According to the World Health Organization, we need age-friendly environments, and we need to change the way we think about aging and about older people. The age-friendly framework includes 8 domains that relate to the physical and social environments in which we age. As you can see on the slide, there are 8 domains outlined here, and I'll try and I will give examples of each one. Number 1, community and health services. An example of this is to minimize the economic barriers impeding access to health and community support services. Number 2, communication and information. An example of this is to have regular broadcasts of things of interest to older people in the community. Number 3, social participation. An example here is when there is consistent outreach to include people at risk of social isolation. Number 4, transportation, which is dear to my heart. An example of this is voluntary transport service is available when public transportation options are limited. Number 5, respect and inclusion is where older people are included in community activities for families. Number 6, we have civic participation and employment, where decision-making bodies in public, private, and voluntary sectors are encouraged to facilitate memberships of older people. Number 7, housing is where sufficient and affordable home maintenance and support programs are available to seniors. And number 8 is outdoor spaces and buildings is where as an example, where special customer service arrangements are provided, such as separate queues and special service counters for older people. These examples that I have given are from the World Health Organization's checklist of essential features of age-friendly cities. This checklist is a tool for a community to use for self-assessment in all of the domains that I have mentioned up on the slide. It can aid in creating a plan to address gaps or to make needed improvements to services and programs. Each community's strengths and areas for improvement will of course vary from individual to individual. Next slide, please. Thank you. The framework encourages seniors to be involved in accessing a community's strengths and deficiencies. Seniors can describe how the checklist of features matches their own experience of the community's positive characteristics and barriers. To be age-friendly, a community involves seniors in suggesting changes and in implementing and monitoring those improvements. Age-friendly communities treat citizens as builders, as creators, and as well as contributors. Encouraging and recognizing the contribution of older citizens is central to ensuring respect and inclusion for all. In developing community, we need to ask this question: do these ideas and initiatives connect people of all ages? When a community begins to consider how its services and infrastructure connects people of all ages, it not only supports the health of individuals, but of the community as a whole. By working together in a community, we can invent new ways to connect people and create a community that is healthier, more prosperous, and of course, more fun for everyone. Next slide. Making lasting age-friendly changes in all of the domains domain areas of a community requires the support and involvement of local government. In Edmonton, for example, our mayor committed the city's involvement in implementing our age-friendly action plan. We were happy to be recognized by the province for our age-friendly efforts back in 2004, and we were delighted that so many of the city councillors were on hand to help us mark the occasion, because their support and involvement has been a key to sustaining the work on our age-friendly action plan. Having community leaders on board to champion the work helps. Now I'd like to turn the time over to my friend Raynell McDonough, who is going to tell you how the City of Calgary has embraced the use of the age-friendly framework to make their community more supportive and responsive to the aging population. Over to you, Raynell.
Thank you, Caroline. Can you hear me?
Yes.
Yep, we can hear you.
Yes. Okay, so thank you, Caroline. My name is Raynell McDonough, and I am an next slide, please. I am an issue strategist at the City of Calgary. I've been involved in developing and implementing Calgary's seniors age-friendly strategy for the past 5 years. In the following slides, I'll describe how Age-Friendly Calgary started, who has been involved, and provide some examples of initiatives that we've undertaken and the impact that result from being an age-friendly community. Yes, this slide is great, thank you. So before I begin, I'd like to acknowledge that while in many ways our experience in the process of becoming more age-friendly has been similar to that of other cities, the specifics of which community stakeholders are involved, which issues we've prioritized, and which projects we've undertaken are specific to Calgary. And as a city of over 1.2 million people, Calgary already had many services and supports for aging in the community when we began this process, including, for example, Meals on Wheels, accessible public transportation for people with disabilities, and active senior centers and cultural centers. The community needs, priorities, and key partners involved might be quite different in other locations. Next slide, please. In early 2013, a group of nonprofit service providers called the Older Adult Service Providers of Calgary, who are now the Older Adult Council of Calgary, identified the need for a community-wide strategy to prepare for Calgary's aging population. Members of this group met with Calgary City Councillors to make case for municipal involvement and leadership in an age-friendly strategy. In July 2013, Calgary City Council determined that the city would take a leadership role in the development of a community-wide seniors age-friendly strategy based on the framework of the World Health Organization's Global Age-Friendly Cities Initiative. In addition to seeing the need for an age-friendly strategy, members of council also noted that the strategy would align well with one of City Council's stated priorities for the 2015 to 2018 business cycle, which was to respond to the needs of an aging population, and to the Sustainability 2020 target for Calgary to be an age-friendly city by the year 2020. So there was local alignment with our priorities. City Council approved the Seniors Age-Friendly Strategy and Implementation Plan 2015 to 2018 in June 2015. And since that time, Calgary has received recognition from Age-Friendly Alberta and the Public Health Agency of Canada, and has become a member of the World Health Organization's Global Network of Age-Friendly Cities and Communities. Next slide, please. Key stakeholders for Age-Friendly Calgary were chosen based on World Health Organization and Age-Friendly Alberta guidelines. A City of Calgary staff team provides backbone support and facilitation, and those involved on the Age-Friendly Calgary Steering Committee are listed on this slide. Our public engagement process involved a telephone survey of Calgarians aged 18 and over, focus groups with older adults and family caregivers, and a strategic mapping exercise with a wide variety of individuals and organizations. In the implementation phase, 2015 to 2018, new and existing stakeholders come together in action teams to complete projects that contribute to our Age-Friendly Calgary outcomes. We feel that everyone has a role in creating a more age-friendly Calgary and continue to welcome participation from a broad range of stakeholders. Next slide, please. The Seniors Age-Friendly Strategy and Implementation Plan 2015 to 2018, pictured here, includes 6 local priority areas. These areas were adapted from the 8 theme areas in the World Health Organization's Global Age-Friendly Cities Guide, and that Caroline outlined just previously. Changes were made based on local priorities in Calgary that emerged through the public engagement and strategy development process. For example, Calgary stakeholders saw a great deal of connection and overlap among the topics of respect and social inclusion, social participation, and civic participation and employment in terms of our initiatives locally. In the Seniors Age-Friendly Strategy, these areas are combined into the participation and inclusion priority area. Stakeholders also agreed that the prevention and response to elder abuse should be included as a priority area in order to raise the profile of this often hidden issue. Next slide, please. Since 2015, Age-Friendly Calgary has made progress on several initiatives in each of the 6 local priority areas, and I'll highlight a few here. Launched in 2017, our Age-Friendly Business Program recognizes local businesses that meet a set of age-friendly and accessibility criteria by providing them with a promotional window sticker and including them in an age-friendly business listing and map that's available to the public. Next, at the International Play Association's Triennial World Conference in September 2017, the Age-Friendly Calgary Steering Committee became a signatory to Calgary's Play Charter in support of children's right to play. The Intergenerational Play Project involves collecting games that older people played as children and packaging them as a resource to facilitate and encourage intergenerational play. Next, the Missing Seniors or Silver Alert Project is working with local police and not-for-profit organizations to involve the community in finding vulnerable older adults who go missing. The Aging in Place Laneway House is a project of the University of Calgary's Faculty of Environmental Design to create an innovative housing option that supports the needs of frail older adults. In the past year, the university worked with the City of Calgary to pilot the housing unit in a community setting. And finally, earlier this year, Calgary Transit conducted public engagement with Calgarians aged 65 and over about their experiences using transit. Through a partnership with Age-Friendly Calgary, Calgary Transit was able to engage with a large number of diverse older Calgarians, and older Calgarians were able to participate in this engagement process that influences decisions that affect them. Next slide, please. As many of the actions in Calgary's strategy are focused on sustainable long-term change, we're only now starting to see many of the impacts of the work that we started in 2015. One example of community impact is the uptake that we've seen in initiatives that promote and celebrate a positive view of aging. Age-Friendly Calgary has hosted a series of meetup group discussions and conversation cafes on the topic of aging, and has conducted age-friendly photo shoots to increase the stock of age-positive photos for communication materials. With this momentum starting to increase, a Top 7 over 70 awards program and a film festival about aging were initiated and managed in the community, external to the Age-Friendly City of Calgary staff team and steering committee. However, the presence of the Seniors Age-Friendly Strategy helped both projects to receive municipal support and/or funding. A second example of community impact has been through the Active Aging Strategy. Calgary Recreation within the City of Calgary is achieving its goal of more older adult Calgarians, more active and creative more often, by offering many free activities during Seniors Week, partnering with community associations in order to shorten travel time to fitness programs, and providing recreation education workshops that help with short-term and long-term planning for an active life, among other initiatives. Finally, through the support of funding from Alberta Seniors and Housing, Age-Friendly Calgary has increased awareness of elder abuse through communication materials and events, and has strengthened and formalized connections among service providers through the collaborative creation of a networking guide and shared reporting processes. I welcome questions about any aspect of Calgary's experience as an age-friendly community in our Q&A session that follows. I thank you and will now hand back to Carol.
Great, thank you so much. Thank you, Raynell, and thank you for Carolyn for your the great job that you've done highlighting a number of things about age-friendly communities, and for example, why creating age-friendly communities is important, not only from a aging population perspective, but also from an individual perspective and how it benefits the individual senior. Caroline, you touched on the value of involving seniors and assessing the community's strengths and deficiencies and how important it is to get that senior's voice when you're making changes or looking to what programs and services are needed. How using the 8 age-friendly domains can improve the physical and social support and support health of individuals and communities as a whole. So you're supporting the health of an individual so then you have a healthier community. Also, the valuable role that municipalities play in supporting and promoting age-friendly. They need many partners, but there's a number of things that municipalities have responsibility for, so it's helpful to be able to engage them in your age-friendly work. Raynell, you provided some ideas for who could also be involved in supporting and championing age-friendly initiative beyond the municipalities. And also thank you for those great examples of priority areas and the different initiatives, from the age-friendly business to talking to seniors about transit, and then talking and holding cafes about positive aging and changing that, that perspective that people have about aging. You also talked about how age-friendly is impacting the older Calgarians and the changes that it's making, although it's taken time from when the strategy first came out, but that you're starting to see some change and seeing some impacts there. You also emphasize that communities of any size can start this dialogue on how seniors' needs are being met, and just that there's no preset expectations of what communities come up with for a plan. Each plan is unique to the community, depending on what resources they have available and what the needs are within the community, and that communities are just encouraged to start the dialogue with the seniors and with the other members in the community to see what can be done to improve the quality of life. For those of you who are watching today, if you're interested in finding out more about the process for becoming age-friendly, I would encourage you to check out the Seniors and Housing website to look at the guides that we have developed, and also some other tools and resources that are there that help lay out the steps from forming a community to doing an assessment and developing a plan onto provincial recognition. And the information for the website will be on the final slide, as well as some information on the other age-friendly initiatives and how you can get some specifics on those as well. And so that brings us to the end of our presentation portion of today's webinar. And so we'll now have we'll take about 15-20 minutes for questions. We wanted to make sure that we provided enough time for that to start some dialogue with different communities and answer any questions that you may have. Just a reminder, if you do have questions, to please click on the Q&A question mark on the top right hand of your screen. follow the prompts and then click ask, and Doniko will then pass those along to us. And our presenters will answer as many questions as time will allow. And if you're asking a question, if you so choose to let us know where you're from or any interesting kind of tidbit, how's the weather, where you're calling from or where you're dialing in from, would be great. And then I will wrap us up when before it's time to close. So, Danica.
Okay, thank you, Carol. So there are a couple of questions coming in. The first question to the group is, can anyone join the community of practice?
And do you want, I'll take a shot at that one. As I mentioned, this is something that has just recently started to form, and the members that are participating have been coming together to talk about how this is going to move forward. And the plan at this time is to include other communities, those that are just interested, those who are on the path, and continuing discussions on how best to share that expertise and that best practices. Is it through more webinars or more other information sharing platforms where we can reach a broader audience, but then also have a core possibly that can help to guide and direct that. So if folks are interested in either participating on the community of practice or hearing more about it, when the survey comes out, I would encourage you to include that in your comments, and we will continue to be in touch with more information.
Okay, thank you very much. We have another question. How do you keep the momentum of your age-friendly initiative going?
I can probably take a stab at that. Hello?
Yep, yeah, we're here.
Hi, it's Raynell. I can probably take a stab at that. So in Calgary, as I mentioned, we've been going with our age-friendly Calgary plan since 2015. One of the things that we did intentionally in order to keep the momentum going was to link the implementation cycles of our age-friendly strategy with our municipal business planning cycles. So in our municipality in Calgary, we plan on 4-year cycles, like 2015 to 2018, 2019 to 2022. And so every 4 years, like this year, there's quite a real reflection on what we've done in the past, and then a look towards the future at what we want to do for the next 4 years. And I think by linking our age-friendly strategy to this municipal process, it really helps us to stay relevant within the municipality, within other departments and business units, because we're having the same conversations about what have we done with our age-friendly strategy over the last 4 years, and where are we going in the future for our next implementation cycle, at the same time that our planning department is having those conversations, and our transit department, our community services as well. And so that has really helped us to stay, I think, relevant and on the same schedule as a lot of other municipal services. I think also one of the things that we've done that we've really intended to do is take advantage of opportunities and emerging issues as they arise, even if they're not identified, in our annual work plans or in our 4-year implementation plan. So an example of that I mentioned earlier was the intergenerational play project. That's not something that we would have foreseen. It's not something that we had planned in our 2015 to 2018 implementation plan. But as we were in the process of implementation, the City of Calgary was one of the hosts of this international play conference, and it had a lot of momentum. It had a lot of interested stakeholders in the community who were looking at this issue of supporting children in play. And so in order to maintain our relevance and our momentum, we really considered as a steering committee, what role do older adults have in an aging society in supporting the right of children to play. And so that resulted in our signing of the play charter, in the development of our intergenerational play project that we're doing this year. And I think that really helped to link us to what is relevant and what is current in Calgary, in our community. One last thing I would say is that we are more and more, I think, now, more than when we started, trying to find connections with related initiatives in our community. So things like who is working on accessibility initiatives for people with disabilities of any age, and how can we connect better to link those issues of aging and accessibility? How can we link better with initiatives in the community around dementia friendliness, or other similar sorts of initiatives around inclusion of newcomers in our community? How can we link with that in terms of the needs of older newcomers? And so more and more, I think the ways that we're trying to find connections has really helped us to maintain that momentum.
Great, thank you, Raynell. Carolyn, did you have any thoughts on?
The thought that came to mind for myself, I haven't been involved in the implementation of the first phase, but I guess moving into age-friendly Edmonton, the next phase, which we are embarking on, and I will be providing support in that area, is looking to the people that have provided leadership on our previous working tables, and we're going to be inviting a lot of those people that have passion and have shown leadership in the area, and I think that will really help us to stay grounded and help us to move into this next phase. People who are passionate about what they're doing and people that have shown leadership in the area. So that's what I think.
Great, thank you. So Donika, do we have more questions?
Yes, we do. We have another question, and it is, what's the difference between age-friendly and dementia-friendly communities?
That is a good question, and I don't know, Raynell, are you okay if we tag you again, because you did just mention something about dementia-friendly in your last comments?
Sure, yeah. So in general, age friendliness really has to do with the aging of the population, and so it's about the health, participation, and security of older people in our society as they're aging, and the full diversity of our aging population. And so that means people who are from very physically well to very physically frail, people who are very cognitively well to people who are experiencing dementia. It's a full range of the experiences of everybody in our society who is aging. And I think as well with Age Friendly, a lot of us do focus as well on intergenerational aspects as well. So whether that's building community relationships between older and younger people, also looking at ways of supporting people to age with preventative strategies that might start before the age of 55 or 60 or 65, to ensure good health and good social relationships as we enter our older years. With dementia-friendly communities, there's a lot of similarities in terms of it's also about creating physical and social environments that really support people to live well in their communities, but it is focused much more specifically on the needs of people who are facing cognitive challenges due to dementia. And so the specific sort of interventions that are happening in the community, a lot of it is about raising awareness specifically about how dementia changes the brain, how to better communicate with and include people with dementia in the community, how local businesses or other local organizations can be more inclusive and better make sure that their information and services and accessibility are well suited to people with dementia, and also very much a mindfulness of caregiving as well, and the support that family caregivers and friends and family and neighbors play in the support for people with dementia. And so in Calgary, we do have our Age Friendly Calgary initiative, and we have a Dementia Friendly Communities pilot project through the Brenda Strafford Foundation. It has received funding and support from a number of places, including Alberta Health Services and the province, and they are developing a toolkit where they're identifying what needs to be in place for a dementia-friendly community, who needs to be involved, what sorts of information do you need to have, and then at the end of their pilot project, coming up quite soon, they will be sharing that toolkit with other communities so that they can likewise develop dementia-friendly communities. Here in Calgary, I see it as a very complementary sort of initiative to Age Friendly, so that they can both work in tandem. Since so many people who have dementia are also in their older years, who are also aging, it is important that an age-friendly community is also a dementia-friendly community.
Great, thank you for that. And again, I think it just kind of echoes the whole thought of depending on what the community's needs are and who's in the community when you do the assessment or you go out and you talk to seniors in your community.